is medical anthropology used to improve public health care? Imagine a world where health programs fit perfectly into people's lives and beliefs. That's what medical anthropology aims to do. It's like having a map that shows how culture, society, and environment shape health. When we understand these factors, we can make healthcare better for everyone. Medical anthropology uses special methods like talking to communities, observing daily routines, and studying local beliefs. These methods help us see what people really think about illness and treatment. By studying different cultures, medical anthropologists find out why some groups might avoid certain medicines or prefer traditional healing. This knowledge helps healthcare workers respect local customs and encourage people to get care. For example, if a community believes illness is caused by spirits, doctors can work with local healers instead of dismissing their beliefs. This makes treatments more acceptable and effective. Medical anthropology also looks at social factors like income, education, and gender. These things influence who gets sick and who can access health care. When we understand these social barriers, public health programs can be designed to reach the people who need help most. For instance, if women in a community don't have transportation to clinics, programs can include mobile health units or community health workers. Another big role of medical anthropology is improving communication. Sometimes, misunderstandings happen because of language or cultural differences. Anthropologists act as go-betweens, helping doctors and patients understand each other better. This builds trust and makes health advice more likely to be followed. Medical anthropologists also help shape policies. They provide stories and data that show what works and what doesn't in real communities. This helps governments and organizations create health plans that are fair and practical. For example, in fighting diseases like HIV/AIDS, understanding local attitudes about sexuality and medicine can lead to more successful prevention programs. They also help with health education. When health messages are made with cultural context in mind, people are more likely to listen and act. This is especially important in multicultural societies where different groups have different beliefs about health. Global health efforts benefit from medical anthropology too. It helps us see how environmental changes and globalization affect disease spread and health habits. This way, international health programs can be more targeted and respectful of local ways of life. In real life, this means designing vaccination drives that address fears or misinformation. It means respecting traditional birth practices while offering safe medical options. It can even lead to discovering new medicines from indigenous plants and healing practices. So, by understanding people's beliefs, social conditions, and environments, medical anthropology helps make public health care more effective and fair. It bridges the gap between science and everyday life, making health solutions work better for everyone.